And so we've now got 7 minutes before, if I'm not wrong, before coffee, standing between you and coffee, just for any questions on, or perhaps the whole question of cancer networks. There's been the most thing we've just been hearing about. Those from other countries might like to feed back. Gennaro there in the front, the Irish contingent might like to feed back some of their experience of cancer networks, which has been sponsored by the Ministry of Health. But yeah, please, a microphone to Gennaro.
First, let me thank you and all the speakers for these beautiful presentations. My question is basically an anticipation to the discussion that we are going to have tomorrow afternoon about comprehensive cancer infrastructures. Can you, in a nutshell, explain to us what is the difference between CCNs and CCI?
Yeah, well, Tommy was part of the Cancer Board, which defined the term comprehensive cancer infrastructures these 4 years ago, which is slightly confused the cancer community, I have to say, and I hear different stories about the genesis of this term. I think some people wanted to choose the term, to be slightly more relaxed, not just to be talking about comprehensive cancer centers, but actually networks as well, and it was a kind of either or. But then when OECI was asked to do a specific answer a specific call defined around comprehensive cancer infrastructure, we had a sort of real deep think about that. And we thought, well, what does infrastructure really mean? And we looked at the definition that the Cancer Mission Board had said, which is basically the whole ecosystem in a locality for cancer, bringing together research, innovation, care, and also possibly even primary care. So looking at the whole patient journey, we thought, wow, that really is a huge challenge. So that's how we've defined, or we're using the definition of comprehensive cancer infrastructures, as I say, for the whole of an ecosystem, serving a population of, is it 2 million, is it 5 million, including screening, which of course is often excluded from many considerations of certainly comprehensive cancer centers, because they don't have the responsibility or the accountability for screening programs, or for the population cancer registry. So we've done I'll show a slide on it tomorrow. We've defined the infrastructure as including the public health aspects as well of screening, cancer registry, the care network, and the research network, which is basically everything for cancer patients.
Thanks a lot for the reply. But actually, FICAN doesn't have the ambition to be not only a comprehensive cancer network, but to become a comprehensive cancer infrastructure. The question that I asked to Tony.
Yeah, Tommy, I think if you stand and they'll switch the mic on for you, I think. Will they? No. Right.
Yes, thanks for the question. First, maybe a comment that in the discussion of comprehensive cancer infrastructures, there was also a discussion of, for instance, pediatric cancer, which typically the cancer care is given outside of classical cancer centers, and also a little bit about a European reference network type of activity. So these were some of the motivations to use the word infrastructure instead of center. But then specifically to the question, I think that especially with the plans that we currently, or discussions we currently have of including the Finnish Cancer Registry as part of a larger mission hub, this will indeed fulfill the criteria as described by Simon.
Thanks, Tommy. Thank you. Other questions, please? Just a few more minutes left. There's one there at the back, and there's Joseph here at the front in a moment.
Thank you very much for the presentation. I do have one question. I'm representing the industry, Electa. How can we as industry help you further on your mission?
What a great question. Thank you very much. I don't know what your perception is from industry, but my perception from having come more recently from Cambridge is that the barriers between academia and industry are really coming down, and I see more and more centres who are establishing strategic relationships with industry regarding the relationship not as competitive. There are all, of course, there are the big issues around intellectual property and valorization, etc. Whether and I think we heard from the comment from Onkozon about the establishment of the network as basically forming a good accredited platform to encourage industry to engage directly, not with an individual center, but potentially, if in terms of clinical trials, certainly, with a larger population, which is quality assured throughout that network of 9 hospitals. So I think that's something that should really be encouraged and should really continue. I don't know whether there's a sort of comment too from Ireland, because Leonie mentioned the struggle that in some countries, and Ireland's one of them, to increase the throughput of interventional trials in that country, and whether that can be approached more on a network basis, in tandem with the individual center basis. I'm not sure. I mean, can I invite a comment from John or others on that? Sorry to put you on the spot here, John. And then we'll have Joseph in a moment and get to coffee.
That's a difficult question to answer. I think that accreditation and the creation of functioning networks will have 2 impacts. First, it validates you in terms of dealing with industry and industry's interactions with you. I think secondly, it gives you some agency in dealing with the central authorities who, in our experience in Ireland, have over-regulated and under-resourced clinical trials, which makes it very difficult for us. And industry is really generally interested in one thing, which is your metrics and your times for getting clinical trials up, running, and getting patients on clinical trials. And that's what we struggle with. And I think that this has to be part of a multifaceted approach to dealing with that problem, as in dealing with it in a unified way, as part of a network, etc., and giving you agency in that area. So it's hard to be more specific than that. The problem is multifactorial, but I think everything you can do to strengthen your hand to try and address these problems is important, and this is one part of that. I don't know, John, if you have anything to say to that. Yeah.
Thank you, John. I hope that's a partial answer, but I think you're hearing, that people are really keen through accredited networks to partner more with industry and to work with you guys very much. Joseph, please.
Thank you very much, first of all, for the presentations on the comprehensive cancer networks. Actually, I have a technical question on the ground, right? So I was asking, both for Tommy and Fabrizia, how much complexity adds to the creation of the network if you have different providers with different IDs. I think that at the end, sometimes these technical questions are important to set up the network, right? So if you have different providers with different IDs in the network, is this a challenge when you create the network or not? Different health providers with different fiscal IDs, right?
I can answer for my part that I think that's an excellent question. So the question is, because, for instance, in Finland we have healthcare is at the responsibility of regions. They have large autonomy. So I think that because of this, the fact that the OSCE accreditation and the national decision to do a national network could well be a little bit more integrated, and because we have a national mandate, the national mandate could give the kind of the strength of binding agreements. Currently, that's not yet quite the case, and that's what I would hope that we would go towards.
Yeah, in the Netherlands, it's national organized, so it's not for the region or the network that we have separate health insurance providers, and doing this accreditation, we're more in contact with them, and they're willing to help us with new projects, but not for the care.
But I think I'm right in saying that in the sort of hybrid insured system you have in the Netherlands, I think you mentioned, or you have mentioned to me, that the insurance companies are also interested in the establishment of the quality assurance across the networked hospitals, which is, I think, is a good step forward, and also for other insured systems, including Germany, that might be an interesting indication of interest by them. Thanks, Joseph, for that question. So, ladies and gentlemen, we now have, I think we'll give ourselves 15 minutes for coffee, and we'll start at 11:05. Thank you very much indeed.